Hello, everyone, and good day. Welcome to another episode of the Second Direct podcast. I'm your host, Dr. Tiwa. Today, we're going to speak about one of the most under-discussed medical conditions that we have in our country today, and this is called diabetic foot. In this episode, we seek to dissect what diabetic foot means, the things to look out for when you have diabetic foot, what conditions are diabetic foot very well known to occur, the complications that can arise, the tests that we need to do, and everything else regarding the management and treatment of diabetic foot. Please stay tuned as we come to inform you better about this particular condition. There's a significant portion of diabetic patients that have this diabetic foot. When it comes to diabetic foot, the reason why diabetic patients have diabetic foot is because there is no information out there in terms of how it is to be managed, how to stem the progression from diabetes to diabetic foot. And this leads to high rate of this diabetic foot even progressing to amputation. It is why there is an amputation rate of 52% with patients that have diabetic foot ulcers. And diabetic foot ulcers are usually the leading cause to diabetes-related mortality in Nigeria after hyperglycemic emergencies. Now, let's talk about what diabetic foot is in itself. Diabetic foot refers to foot problems that occur or develop in people that have diabetes. It can stem from mild infections to severe complications like amputations, as we've stated before. And we have to understand what are the causes of this condition, the prevention for progression to amputation, or even the prevention of leading to diabetic foot itself. And also, what is the treatment and the management of diabetic foot? As this is very vital to make sure that even if this condition is gotten by anyone, it is properly controlled. When we speak about diabetic foot, we also have to speak about what can lead to it or what category of people can have diabetic foot. Now, diabetes can lead to foot problems through two main pathways. First is the neuropathic, and the second is the peripheral arterial disease. When we say neuropathic, neuro means nerve and pathic means diseased. So together we mean bad nerves or diseased nerves. Now, nerve damage or neuropathy means that there is reduced sensation in your foot, meaning that things like feeling of cold or feeling of heat or feeling of pain, you would not readily identify those sensations when you have diabetic foot. On the other hand, we have peripheral arterial disease, which reduces blood flow to your lower extremities or your upper extremities, which is your hands and your legs. When this happens, it leads to the fact that your body is unable to heal from wounds. So what signs and symptoms do we have to look out for when we are looking at diabetic foot problems? First of all, we have to look for swelling in your feet or your ankles. You have to check for changes in skin color of your feet or your ankles as well. You have to check for changes in temperature, comparative temperature. You have to check, oh, is this leg hotter than this leg? Is this leg warmer than this leg? Do I still feel heat or warmth when I'm looking at my feet or looking through my legs? You have to check for any pus or drainage of wounds. You have to check for any redness or tenderness, any feeling of pain that you could sense in your lower legs or in your arms, for instance. We could also check for calluses or corns. When I say calluses or corns, I'm talking about these harsh indentations or harsh feelings that you can have under your foot. So when we look to seek for the best approach to preventing the progression or even to preventing diabetic foot problems even occurring in the first place, the first thing we have to look out for is to control your blood sugar levels. This is particularly important for either pre-diabetic or even diabetic patients because high blood sugar usually leads to the nerve damage. So being able to control your blood sugar effectively is one of the key points that we need to touch on to make sure that we do not have these diabetic foot problems. Another thing that you can look forward to in terms of prevention is to prevent neuropathy with the use of supplements. Now, there are some supplements that have been known to stop or even alleviate neuropathic symptoms. Some of these supplements include vitamin D, which is essential for nerve health and deficiencies that may contribute to this neuropathy. Also, we have water-soluble vitamins like the vitamin B1, thiamine, B6, and the B12, which also play crucial roles in nerve health. Magnesium also is important for nerve functions and may help to reduce symptoms. Remember to always consult your healthcare professional to determine the best course of treatment for your specific needs. They can always provide you with a personalized plan, including the use of supplements, lifestyle changes that are required to help and prevent and also to manage the neuropathy. When we're talking about the symptoms, we talked about noticing whether you have differences in temperature from both feet, whether there's swelling. That leads to one crucial prevention thing that we need you to do, which is regular foot inspections. Examine your feet for cuts, blisters, changes in temperature, redness, swelling. Use a mirror if necessary, especially for places that you cannot readily see or look through without actually visualizing it through another medium. So a mirror will help. A family member can also help to examine in case you do not have the feeling of whether there's any cut in your foot or not. Another prevention mechanism that you can do, have proper foot hygiene. Wash your feet daily. I know this is usually very technical for a lot of people because they always feel like, oh, once I pour water on my body, it already reaches my leg, so that should be enough. No, that is not enough. Be able to go to your foot specifically and make sure you touch them with soap and water. Lukewarm water is best to make sure that everything is very proper with how your foot hygiene is. Moisturize also. Use a lotion or a cream to keep the skin on your feet soft and prevent it from cackling. We have symptoms like calluses and corns that we've already spoken about. Now, trim your nails carefully. The reason why this is important because nails can cause injuries that you would not be aware of. So you have to make sure that your nails are typically short and they are trimmed properly. You can use a file or you can get a pedicure at a salon. Wear appropriate footwear. When I say wear appropriate footwear, choose your shoes very well. Shoes that fit well. People that have their shoe sizes at 46, 47, endeavor to get shoe sizes that are that level, that are comfortable, that don't impede your movements and don't also cause constriction of your feet to the point where you don't notice when you've gotten an injury or you don't notice when you are not getting the best movement from your feet. Wear shoes that fit well and that protect your feet. Don't wear vinyl or plastic shoes because those shoes do not let your feet breathe. And lastly, protect your feet from heat or cold. Because if you have nerve damage from diabetes, you may burn your feet or have frostbite symptoms and you would not know that you have these symptoms, especially if you did not follow the steps that we've already said in terms of prevention or in terms of your feet health that you need to take seriously. So please go through each and everything that I've said in terms of how to prevent diabetic foot problems and take them as seriously as possible, especially for patients that have diabetes and are controlling their blood sugar level. Feet health is very, very, very important for everyone, but it's especially important for people that have diabetes. If you notice any foot problems, please go to your healthcare provider as soon as possible, immediately, because it's an emergency case. Now, when it comes to having injuries on your leg, we can have minor injuries like calluses and corns, which you can do by yourself or seek your medical provider's attention, and it can give you something minor to do or things that you can do to just help prevent its progression. But it can lead to complications such as ulcers or infections that might require antibiotics, and you would need your provider to provide that intervention for you. So when it comes to advanced cases, there are usually significant loss of tissue of your feet. It can also have necrosis. Necrosis means that there is a lot of dead cells, and that might lead to a procedure called a surgical debridement, where the dead cells are tried to be woven off your feet, try to be taken off the feet, as well as parts that have extensive necrosis or extensive dead cells. They are always surgically removed. There's also another advancement in terms of necrotic cells of your feet, which could lead to the feet of the affected person having to go through amputation, where the foot itself is removed. Rehabilitation and wound care are very crucial aspects when it comes to management of diabetic foot problems. So you have to work with not only your healthcare provider has to work with different teams so that they can all come together to form a multidisciplinary team that would be engaged in making sure that everything pertaining to you and your management of that diabetic foot problem is sufficient. Before we wrap up, let's also discuss some additional tips that would also help in regards to a diabetic patient not having diabetic foot problems, or for patients that have diabetic foot problems, for it not to progress even worse than it already has. And that is to stay active, making sure that you move around a lot, avoid sitting for long periods of time. Also, put your feet up. Putting your feet up could also prevent having edema, for instance. Edema meaning that accumulation of water in your feet or your lower extremities area. It can also give you a vantage point to actually always be looking and observing your feet at all times, especially when you're sitting. Another thing is to stop smoking, as smoking impairs circulation. I already spoke about how diabetic foot problems can lead to peripheral arterial disease. When you say peripheral arterial disease, it means there would be poor circulation to your legs and to your arms. Also, go for regular checkups. Schedule regular visits with your healthcare provider so that you can speak to them about your concerns, about whatever you may have noticed over the period of time before, from your last checkup to the present checkup. And this together forms a proper way to look at what diabetic foot problems can be and how to manage and how to prevent them. That concludes today's episode of Seco Direct. In this episode, we have spoken about how to look out for diabetic foot problems, the what to look out for, the symptoms to look out for, the things that you need to do to prevent them, and if it's already occurred, the things to prevent the advancement, as well as the management and the treatment that you can go through if you do have these diabetic foot problems. This is what we seek to provide at Seco Direct, constantly informing every one of our viewers as to how to manage different medical conditions. And if you have any questions for us, be sure to make sure that you leave a comment below and subscribe for more tips on how to manage different medical conditions in our landscape and in healthcare. Thank you very much for listening to today's episode. I remain your host, Dr. Tiwa. Until next time, I'll see you again.